In light of the current situation in Kuwait and the rising numbers of COVID-19 cases, Mubarak Hospital recently set up a COVID-19 emergency unit which is fully equipped with the necessary medical supplies and equipment needed to treat COVID-19 patients.
Also, the emergency unit, according to a medical personnel at Mubarak Hospital, is ready to receive COVID-19 patients effective immediately. Ministry of Health Sheikh Dr. Basil Al-Sabah toured the COVID-19 emergency unit along with Ministry of Health Undersecretary Dr. Mustafa Rida, where they offered their input and exchanged ideas with medical personnel at the COVID-19 emergency unit at Mubarak Hospital. Reporter Ghanwa Jabbouri brings us more.
According to the Ministry of Health, the Kuwait tally of COVID-19 confirmed cases in Kuwait currently stands at 1,355. In light of the increasing COVID-19 cases, Kuwait has had to ramp up its fight against the novel coronavirus and increase its medical abilities to treat confirmed COVID-19 patients. Therefore, Mubarak Hospital recently set up a COVID-19 emergency unit centre on its premises, but separate from the hospital, to treat people infected with the coronavirus.
Basically, this is a field ER, all right? So what we're doing is we're trying to split up the main ER, so we're calling it the clean ER, from the suspected cases, because we're still receiving patients with regular complaints. So we're trying to separate those from the patients who might be suspected to have corona or not. These suspected patients are coming to a separate area, this place, the field ER. The field ER, we're trying to divide up the stable cases and the unstable cases, all right? So the stable cases, at the door, or just at the entrance of the hospital, we're going to figure out if they're stable or not by asking a few questions. If they're stable, we're going to contact the COVID team up in the wards, and if they're accepted, they go immediately via golf cart straight to the wards, okay? So these patients shouldn't be hanging around here much. The patients that are going to be over here are unstable, patients that cannot be transported anywhere. They need to be dealt with. We need to stabilize them, but they cannot be stabilized inside the hospital because they are suspected to have corona.
The COVID-19 emergency unit can currently accommodate up to 24 patients. However, the emergency unit can accommodate more patients if the numbers increase.
We're calling it the clean ER, but I mean, it's just a term, but basically all the cases that are not suspected to have corona. So someone with a heart attack, for example, that's not necessarily corona, right? So this person would go inside. Someone with a problem with his appendix, right? Appendicitis, that's not suspected to be corona. He'd go inside. These people should not be mixing with corona patients because then they might get infected, correct? So that's why we created a field ER for the suspected cases only. So anyone who works here is going to be exposed to patients with corona. So anyone who works here is going to be wearing a full PPE, personal protective equipment, okay? And there's a donning and doffing area for us to change into and change out of them. And that's what it is, basically.
Furthermore, the COVID-19 emergency unit is fully prepared and has all the medical equipment needed to treat coronavirus cases and is expected to start receiving cases immediately. A COVID-19 emergency unit has been set up by Mubarak Hospital on the premises of Mubarak Hospital to receive COVID-19 suspected cases. From Mubarak Hospital, Jabriya, I'm Ghanwa Jabbouri reporting to you for the English News.